We are back once again, ladies and gentlemen, and of course, you are watching Ask Your Pediatrician, and of course, this is the program strictly dedicated to talking about the health and the welfare of children, and of course, we look at various issues affecting the health of children. And today, we want to focus on one particular angle of the health of a child, and of course, we want to focus on growth monitoring and promotion as well. So within the course of our discussion, we're also going to reflect on issues like what the under 5 card is all about, and of course what is contained in that particular under 5 card. Well, obviously for a mother, that is a very, very important card, and of course for many women, it's a card that allows them really to monitor the progress and of course the growth of their child in as far as the growth promotion is concerned. So that is one particular issue that we are going to look at on the program today. And of course, I'm joined by a specialist in this particular field who is going to help me discuss this particular item. Welcome to the show. Good to see you today.
Same here.
Thank you so much. Otherwise, how is work?
Work was fine. Busy Sunday.
Definitely.
But I'm glad to be here.
Interesting. To start with, what is growth monitoring and promotion?
Okay. So growth monitoring and promotion is basically a process. This is a process where we're trying to follow up a child over a period of time. We take several measurements and then compare them with the standard measurements that are known for a particular age, for a particular race, and for a particular sex. As you know, boys are different from girls, so even when you look at the under 5 cards and the way we do growth monitoring, it's a bit different. Even the environments where we grow are a bit different. So you see in the whole process of growth monitoring, it helps us look at the child, the way the child is growing in terms of gaining weight, the way the child is attaining several milestones, that's in terms of development. Is this child growing the way it's supposed to grow for a particular age? And that is done based on a social setting for a particular country, for a particular area. It's important to have our own local data.
Interesting. And why do the growth and monitoring process?
Okay, so first of all, growth and monitoring it's a process that I've said earlier on. It has to go on for several years, up to about the age of 5 years, which is what we recommend. And it helps us assess the child's growth. So you see that if this child is not growing, then we can intervene at a particular point to say there's something wrong. Let's intervene and refer this child to appropriate care. It also allows contact between the family and the healthcare system. Then you're able to access several facilities that are able to be there. For instance, the major one that I'll talk about is the HIV/AIDS. So you find that with growth monitoring, when the child is brought in for growth monitoring, you're able to assess whether this child is exposed to HIV, whether this child is infected or not infected. If this child is infected, we're able to refer the child for appropriate treatment in the next facility. We'll notice that it's one of those objectives. I'm sure as a country we do remember a few months back when there was that test and treat, where everybody comes into the hospital, we need to test and treat. So growth monitoring provides a linkage to other facilities. It provides a linkage for us to give even other multivitamins like vitamin A. Vitamin deficiencies can be prevented. It helps us prevent infections that are there. So I'll take you back to the 2013-2014 demographic study, which was done by CSO. It showed that 75 out of 1,000 babies die every year from preventable diseases. And these diseases are malaria, malnutrition, pneumonia, measles, and diarrhea. Not in that particular order, but you notice that from those, all these are preventable diseases. And those 75 babies that we are losing can be reduced. And you see that malnutrition accounted for about 42% of those deaths. So, and then malnutrition is one of those that is critically tackled in our growth monitoring and promotion.
Interesting. What are the objectives of the GMP?
So some of the objectives are that we need to assess the child's growth regularly and compare it to what is appropriate for a particular age. It has to give us linkage to the various health facility services that are needed for the child. It also helps us provide contact for the healthcare system. It means that you are able to get access. The mother is able to ask several questions, or the guardian, to the healthcare, to the health system, and they're given that information. Nutrition is one of those that is important. So it helps us cover, especially for growth and monitoring, for the first 1,000 days, which goes up to about the age of 2 years. It's very critical because the way a child grows, it determines the brain growth. If this child is growing nutritionally well from the time that they're pregnant, the mother is pregnant, we take care of the mother during antenatal. When the child is born, we do our continued growth monitoring and promotion. Brain growth is quite good, and this results in children that are quite more intelligent, reduces the prevalence of stunting, and prevents acute malnutrition if we do the growth monitoring and promotion.
Interesting. So now, this being a process, obviously it has got some components. What are some of the components of a GMP?
Of GMP. So some of the components are, first you have the growth itself, where we need to measure the height. We need to measure the weight for the particular age that is there. There's also what we call the mid-upper arm circumference, which can be measured when they do that. That can also help us assess the nutritional status of this child. Then it has also areas of immunization. On those areas of immunization, there are various immunizations that are given for a particular age that the child attends. For instance, BCG will be given between the first 13 days of life. At 6 weeks, we'll give another particular immunization that is there. Then it also has assessment on the development of the child. So those are some of the components that are there. Then also linkage to other facilities, other services within the healthcare system that is there, and referral where appropriate.
Interesting. All right, so ladies and gentlemen, the topic of discussion is the one that is scrolling on your screen there, and of course the text line is the one that you can be able to see on your screen. So if you've got any questions, any issues pertaining to what we are discussing today, you can as well just hit our inbox, and of course Dr. Zimba should be able to respond to some of the claims and of course some of the questions and some of the issues that you might have. Remember, we are discussing growth monitoring and promotion. Now, when we are talking about growth monitoring and promotion, the GMP, what period or what period does it cover?
Okay, so we normally want to cover all children below the age of 5 years when we talk about growth monitoring and prevention. But I must be quick to mention that growth monitoring and promotion does not stop at age of 5. It can go on for several years to go on. But the critical one are the children below the age of 5. We concentrate on the children that are below the age of 2, those who see them monthly, because we want to make sure that they're gaining the actual weight and they're doing appropriate things that are there. Between the age of 2 and 36 months, we can start seeing them every 2 months. Then between 36 to 60 months, we can see them every 3 months. But all parents that bring their babies every month, we encourage that they come to them. You will notice that with our health system in Zambia, the dropout rate in terms of follow-up for the patients, the first 6 months is quite good. We're at about 80 to 90%. After 6 months, our parents don't bring back the babies for us to see them. And they tend to think because of the immunizations are no longer given between 6 months, the next dose is at 1 year, 8 months. So that also leads to a dropout because the parents just think they bring the babies for weighing and that's it. They bring the babies for weighing. But that weighing is actually very important. Important thing and helps us determine whether the babies are growing well or not growing well. So the important tool that we'll do use is the under 5 card. So this card is actually the passport for the children. So I think like the one we projected there will show us that it looks at the weight. If you looked at that card critically, you'll see that there's weight. It also looks at the point where you're showing that there are danger signs, like on the top right corner. We can see there's a line which is going upwards, which shows that it's good. The line which is horizontal, which is flat, is showing that's a danger sign. So when you take your child for under 5 and the weight doesn't go up, it gives us a horizontal line. It tells that there's a danger sign, there's something not being done correctly. And that gives us a child to intervene. If the child's weight has not increased and it's coming down on the under 5 card, that shows that it's a very dangerous sign. So this child needs to be referred for appropriate action. So these two where there's danger and that will be referred for appropriate action to determine. Because there could be other causes, apart from just nutrition, that can be causing why this child is not gaining weight. They could be having a problem, either it's a heart problem that they have, they could be having an infection, they could be having poor nutrition, they could be having other comorbidities that may be there. So this, on growth monitoring and promotion, gives us a time when to say we're going to refer this child. We'll notice when you come onto the chart, there are these 5 lines, sorry. Then we have a green line in the middle. So that green line in the middle is what we call the median. Most children should follow that line that is there. The ones you see on top, that is the +3 and the -3. The +3 means that this child is actually above weight for that particular age. So that one is one of the areas where we're going to see that most of the time when we talk about malnutrition in children, we always look at those that are undernourished. But when you see there are those that are above 3, those are overnourished, which is a problem. Remember, we're talking of non-communicable diseases. We're beginning to see an increase in children getting what we call the type 2 diabetes, which is similar to the ones that adults have. And it's because of bad nutrition. They're getting overnourished. When you look at the ones that is below the -3, the one which is in the dotted line at the bottom, that one tells us this child is malnourished and is severely malnourished. These ones have bad nutrition as well. They're the ones who lack nutrients. These are the ones who actually cause a lot of morbidity and mortality. That is, they're the ones accounting for that 42% of deaths that are occurring in the first 5 years of life because of malnutrition. So we need to plot on this chart every day that the patient comes. They're not patients because they are well. So they're coming just for normal regular reviews and visits. So we'll plot their weight on that chart according to the age. So the first, we'll see the first column, we'll have the 1 year, the 2 years, up to the as they are going on. Then on that chart, we'll see also there's a baby who's from sitting, standing, and going up all the way. So that chart gives us what is expected at a particular age for this child. So that even the mother can see and say, oh, my child now is able to stand. My child will be able to walk. So we'll see that we shouldn't panic if a child doesn't walk at 1 year. So we'll see that we expect our Alzheimer's children to walk by 1 year, 6 months. So it will be up there. This chart also tells us what to do when the child has, a child has diarrhea. It tells us what to do, how many feeds per day the child is supposed to receive at a particular age that is there. So this chart that we're seeing there is just one component of the under 5 card. I must quickly say that the under 5 card is what we call the child's passport. It's like the NRC. The child should always carry this as their case of, as a sign of identity. So we'll see when I try and project the other from the real under 5 card, because these ones were just, it's a caption of the under 5 card, what they really have to show us on each of them.
All right, so 0955 5016, 0955 5016, that's a number that you are using to get in touch with us and, of course, communicate with us here in the studio. Remember, Dr. Zimba is my guest and trying to explain the importance of growth monitoring and promotion as well. And, of course, trying to also highlight some aspects of the under 5 card. Now, if your child does not have an under 5 card, possibly that could be a serious problem. Now, let me just try to find out from Dr. Zimba, what are some of the implications of a child not having an under 5 card?
Okay, so some of the implications of having under 5 card, it means that this child will not be, the growth monitoring and promotion will not be done properly. Because there are a lot of things that are on the under 5 card that needs to be done regularly. So if a child doesn't have, it means they don't get that care that they need to have. When they go for under 5, for instance, we'll look at, if I showed you the actual under 5 card, unfortunately, I think the camera won't pick it up clear. The under 5 card has the first page which tells us about the child's particulars. So this card will tell us where this child was born, the parents' names, what the parents are, the date of birth, what was the birth weight, where the child was born, and the residence where they were. This may change as we know people shift, but it will show us where they were born. And it helps us give an idea what kind of diseases that this child is going to be prone to having. It tells us whether this child is a high-risk child or not. Because there are those children, I'm not saying all children are not special, they are special children. For instance, if this child was born less than 2.5 kg, it tells us this baby was actually a low birth weight baby. So it will be ticked there. It helps even when you're coming for under 5, it makes you make that decision. Now, a child who doesn't have the under 5 card, it's difficult for you to make those interpretations if they came to you. But you have that. So it will tell us whether there was history of a death in the siblings. The card will tell us. The card will tell us whether this child had received any deworming or has not received any deworming in there. So it helps us, you provide the actual health promotion that is needed at a particular time. When we come to the other things, it also tells us, on the back of it, it tells us that the card is not for sale. It's actually free. So every child should have this card. It's a very, very much free. The boys will have the blue one, the girls will have the pink card. And as we know, girls grow differently from boys, so that is a bit different. So that's why the cards are different, and they also help us determine. The card itself will help us tell us what to do when a child has diarrhea. So a mother who doesn't have a card with like this will probably panic when there's diarrhea. But if the mother knows, has a card, she'll read the card, and somebody would have explained to her during health promotion. It will tell the mother when to worry that this child has pneumonia, Everything is there at the back of the card that the mother will see. And then at every visit that the mother comes for growth monitoring and promotion, there are topics that need to be discussed, which are well highlighted on the card. So we'll see that on the card, the mother should have had the discussion on breastfeeding, should have had a discussion on immunization, vitamin A supplementation. There's also an important aspect, the family planning. Remember that we need to have a family, the mother needs to plan her family, or couples to plan their family well. Having too many children creates more strain on the family. So if a family is not well planned, the resources will actually be more strained. So the growth monitoring and promotion therefore tells us that this information must be tackled when they come for under 5. It talks about the treatment of malaria. It talks about whether HIV and AIDS were looked at. It talks about safe food and safe water for drinking. Remember, we just came back from a cholera outbreak. So if a mother comes for this growth monitoring and promotion with their child, they are counseled and educated on this. The information, the IEC, information education counseling is done. So this helps prevent other aspects of diseases, apart from just what will affect this child. This may spread even into to benefit the family. Then when we go inside the card, we're able to look at the card and say, okay, this card has received the following immunizations. So the immunizations are there. For instance, at birth, this child should have received the BCG and the oral polio vaccine. So the BCG helps prevent severe forms of TB. The oral polio vaccine will prevent polio. This child should have received at least 4 doses. Now we've introduced the IPV vaccine, which we're giving to all children. This is in the aim of trying to eradicate polio. Then we've introduced new vaccines such as the Rota. These vaccines have been with us for the last 4 or 5 years now. The Rota vaccine helps prevent severe forms of diarrhea, the ones which are dehydrating and kidney. So with the introduction of this, we've actually seen a reduction in dehydrating diarrhea from these children, and therefore we're reducing the mortality from those children who are dying from diarrhea diseases. We've also introduced another new vaccine, the PCV, the one which prevents pneumonias. It's there. These babies are supposed to receive at least 3 doses. Then we've moved on to also act on the measles dosage. Previously, babies were only receiving 1 dose of measles. Now they're receiving 2 doses of measles at 9 months and 1 year, 6 months. On top of that, we've added another in the measles vaccine, which prevents rubella. This was a rash that presented similar to measles. So when you are seeing as a clinician, sometimes it will be difficult for you to differentiate whether it's measles or rubella. But in the end, we've tackled this. And remember when I said the top 5 killers in children are all being tackled in the under 5 card. The malaria, pneumonia, measles, malnutrition, and others are tackled very adequately in the under 5 card. On the under 5 card page itself, we also look at the vitamin A supplementation. All babies beyond 6 months, every 6 months have to receive a vitamin A supplementation at a particular dosage. Then we come to the HIV and AIDS. So on this one, the card also gives us information to tell us that is this child exposed to HIV, meaning does the mother have HIV or not? If a child is exposed to HIV, what interventions have been done? If a child is not exposed to HIV, the mother is encouraged that she should be testing every 3 months. Remember that the transmission of babies can be either when the mother is still pregnant, at birth, or through breast milk. So when we test and the mother is tested every 3 months and put on treatment, it does reduce the risk of transmission to the baby. So that is also looked at in there. So and every time the baby presents for growth monitoring and promotion, appropriate tests are done for the appropriate age for HIV. And if the child is found positive, treatment is done. I must say that with the PMTCT, which is the prevention of mother-to-child transmission, where we're putting all women on antiretroviral treatment, we've reduced the risk of transmission to as low as less than 2% as a country. And we are aiming to then bring it to 0. If we could bring it to 0, we'll be very happy. Then we'll have very little transmission. That tells us what to do, and then monitoring of the infant comes out and it tells us again. So as you can see, the under 5 card is quite a good and well full of information document. So if a child doesn't have it, the mother should go to the nearest health facility and get one.
Interesting. My worry could be that, it's not every mother who is learned. It's not every mother who is educated. And it's not every mother who has got, who grew up in an environment whereby they were exposed to reading and all that. So what happens if the mother, perhaps they have the under 5 card, but they do not know how to read?
Okay. So that's an important aspect. Because if somebody doesn't know how to read, it means they will not read this information that is there in the card. But we've tried to make sure that this information is very much pictorial on the card. you will see that even when you look at it, the plates, it tells you how many times, and it's quite a pictorial card. Then, at every visit, there's always what you call information, education, and counseling, where the healthcare provider will sit and talk to them. If you go to our facilities, the communication is usually in the local language for a particular area. So if you're in Lusaka, most likely people will use Nyanja. On the Copper Belt, they'll use Bemba. In Southern Province, they'll probably use Tonga. In Western Province, probably Lozi. So to make sure that the information is communicated as close as possible. And that's why you find that it's unfortunate that, yes, it has to be given in a group, but that way it helps everybody get the information, the same information that is there. They also have demonstration classes for cooking when the mothers present there. So the health information is given to them. There's information and education and counseling done. And the card is as much as pictorial as possible where it necessarily has to be.
Now, when you look at the makeup of a family and also the responsibility of taking care of, the health of a child, does not only lie in the hands and, of course, the mandate of a mother, but also the father has got a role to play as well. So I don't know whether this under 5 card is also supposed to be accessed by fathers who are married, or maybe it's just information that perhaps mothers just need to know.
Okay, so I like that component. So when the component of bringing in the father, we very much encourage fathers to participate and be actively involved in the bringing of their children to under 5 clinics. So you find that when they bring these children for growth monitoring and promotion, those who come with their fathers are given first priority. So the idea is to promote that the fathers can actually come into the clinics and get this growth monitoring and promotion that is there. So the under 5 card is very much accessible for the fathers and the mother. Anybody can bring the child. We promote inclusiveness. Where possible, we encourage both parents to come to the thing. And then when we look at, there's a mnemonic we normally use when we're trying to follow up these children called the GOBIF, where we look at growth monitoring. There's ORS for the prevention of the dehydration and diarrhea. There's breastfeeding. There's immunization. There's family planning, feeding, and the last F in GOBIF is the father, because we want the father to be involved in the management of this child. Family planning, as you know, will not occur alone if you're going to use the mother alone. But if you brought the father on board, family planning will be okay. If you brought the father on board, when you're saying the father, please, can you buy this nutritious feed? Can you buy this? The father will definitely provide for the resources, because now he begins to understand what is there. It will not be like this mother is just thinking of draining my resources, or this mother is being extravagant and the like, because now he's gone to the clinic, he's got the information firsthand, he knows that he needs to buy meals that are balanced. So he knows even when the wife asks for money or the mother asks for money, where the money is going to go. So we strongly encourage fathers to participate in growth monitoring and promotion of their children. As a bonus, those who come with their fathers are given first priority. I used to use that a lot when I was taking my children for under 5. I would always go with them, so by 8:15 I would be done and be heading back for work.
That's a very good system.
Yeah.
That's a very good system. I think it would definitely encourage more fathers to escort their wives and obviously get all this necessary information. But so far, from where you're working from, how is the response from fathers when it comes to antenatal attendance, and of course when it comes to sessions where mothers have to go and such information has to be given to them? How is the attendance level of fathers?
Okay. So the attendance of fathers remains to be a very big challenge. And then you see, because even in most clinics, there are more women-centered. We have very few clinics that target just for fathers to show to come in. So that attendance is still quite a big challenge. But you notice now with the advent of PMT, prevention of mother-child transmission, where we are saying test and treat. So you find that at least on one or 4 visits for antenatal, the fathers will show up. Because that test, when you say want to test the mother, who test and say bring your husband, we want to test the father, then they'll show up. But the uptake has still remained quite low. Men are a major challenge for them to present to the hospital. It's either they claim to be so busy to be being at work or not. But we've tried to create those incentives. Even when you come for antenatal, if you come with your partner, you'll be attended to quickly so that he can go back to work. If you come for under 5 with your child, as a father, we'll attend to you quickly so that you can get back to work. So that's one of the incentives we're trying, so that we can attract men to come into those clinics. The father is an important figure in healthcare providing. We need him to be on board.
You're still watching Ask Your Pediatrician, and of course today we are discussing growth monitoring and promotion. And of course, right about now, we are looking at the information that is contained on the under 5 card. And of course, like Dr. Zimba has pointed out, the under 5 card is the passport of the child, is the child's passport. It contains everything that you need to know about the growth, the progress, and of course, and the development of a child as well. For now, we take a break. When we come back, I also want to probe deeper. I want to probe, Dr. Zimba a little bit deeper on some of the things that, the under 5 might actually pinpoint. For example, how about if the under 5 card indicates that the child's growth is not steady? How about if it shows that the child perhaps somehow might be experiencing a stunting growth? What are some of the things, or what are some of the recommendations that are made? Or if you as a parent, you realize that maybe despite your proper feeding program, your child seems to be not growing according to the way you expect, what are some of the steps that you need to take as a family, as a mother, as a father, as a family together? What are some of the things that you are supposed to put to put in place just to ensure that your child is responding properly according to your diet that you have stipulated, and of course according to the guidelines themselves. So those are some of the aspects that I want us to come and look at immediately after we come back from the break.
Meet the Bundas. The Bundas are a typical modern family, and just like you, they always need to be connected. You see, Mr. Bunda needs rock-solid internet to share files with the office. But with his home broadband, syncing can take hours, and video conference calls, forget it. Charmer just wants to download his favorite show, but he may grow old before that happens. And Gran, she just wants to get to level 20. Their home connection is useless when everyone's online. And when the weather turns bad or the power goes off, the Bundas are left disconnected. High Fibronics brings the best fiber internet to your home. Unlike outdated ADSL, which shares your old unreliable copper phone line, High Fibronics uses a dedicated high-speed fiber cable. This runs underground straight to your home, making it resistant to lightning and weather. If fiber's already available in your area, we'll connect you within days and with minimal disruption. High Fibronics is capable of speeds up to 100 megabits per second to and from your home, with room to upgrade in the future. Forget buffering, interruptions and delays. Get awesome, uninterrupted service all the time, letting you do what you want online when you want. You deserve to live like this. Go to www.highalive.co.zm or call 255 037.
Hello! Hi guys! Hello, beautiful people! Very best of entertainment, fun, excitement, and everything LSK.
Everybody who's in Zambia, you're Zambian too, you know what I mean? So, yeah, man, we're just so happy.
We love local. All of your favorite Zambian hits. And much more. Z Rampage, Fridays 9 to 12 on QFM.
All right, so welcome back, ladies and gentlemen. And of course, in case you're just tuning in, you are watching Ask Your Pediatrician on QTV. And of course, our topic of discussion today is growth monitoring and promotion. So we're looking at how is your child responding to the food you're giving your child? How is your child responding to growth? How is your child responding also to to different, things put in place to ensure that, your child is able to grow. Now, possibly at this level, Dr. Zimba, I would love to find out from you, what are some of the things that determine a successful GMP?
Okay. So what determines successful growth monitoring and promotion is the uptake, are the people taking it up. Are we meeting our referrals that need to be, parents and the children being referred appropriately? Is the outcome, is the growth of a child being achieved? That is there. So those are some of the things that we look at. So if we say our uptake is at 90% or 100%, then we say we are now using, the uptake is quite good. Are we getting the appropriate referrals? Have we reduced the mortality? That is, remember I said 75 out of 1,000 children die every year, according to 2013 statistics. But have we reduced that? So those are things that help determine whether we've achieved what we're supposed to achieve and whether it's successful. Are people taking it up? So you find that if we go to the under 5 clinics today, we only see 20 people, then we're not achieving what we're supposed to achieve. So it's uptake that determines whether we have achieved our goal. And are we getting out the information that needs to be done? Are people getting as close as possible to health facilities that they are? Are we preventing disease? So that determines the aspects that we are. So if we see a good uptake in immunizations, we see a reduction in say pneumonia, we see a reduction in vitamin A deficiency, we see a reduction in measles, it means we have achieved, our determinants are good. That determines our good promotion and good growth monitoring and promotion.
All right. Now, still getting you back to the under 5 card. Imagine, I'm sure you have come across situations where, you notice that the under 5 is not showing consistency in the growth of this child. Sometimes there could be, the child's growth is not consistent, and of course, you as a healthcare provider, you as a doctor, you begin to get concerned and of course get worried. How do you handle such situations?
Okay. So normally the growth monitoring, yes, the doctor is at the center of it all, managing the patients, but the actual growth monitoring, you find the ones who do the actual anthropometric measurements are the nurses. So when they do the anthropometric measurements, they keep plotting on the chart. Mm-hmm. So the nurses are taught how to plot. And then whichever healthcare provider is there is taught how to plot on the chart, such that when they notice that there's a danger sign, remember I talked about the danger signs, there was one which was horizontal, and the very dangerous sign when it starts coming down. Mm-hmm. When you notice that there's a danger sign, interventions have to be put in. So now we begin to find what is the cause of this child not to be gaining weight or not to be growing appropriately. So there could be several reasons that determine why this child is not growing appropriately. So the healthcare provider who's doing that now refers appropriately. So that's why I was saying the growth promotion provides a linkage to other health services. Because if a mother brings this child who's not growing appropriately, then they'll refer. They'll refer to a pediatrician or a doctor or a clinician basically, who will now assess this child to find out why this child is not getting the appropriate weight. The first thing we'll look at, yes, is the feeding adequate. You will notice that, especially at that time when many mothers tried to give formula feeding, you find that they were not mixing the formula appropriately. The formula is just dilute because it's white, the mother thinks it's milk, and they're giving this child. You find that this child is not gaining weight. When you go back in the history, you find that it's the feeding which was not adequate. So if the feeding is not the problem as adequate, you do feeding counseling, advise the mother what to feed, and everything that is done. If you find that the feeding is appropriate and the child is not gaining weight, now you go back and look at what are the possible causes of this child not gaining weight. Common things are infections. Infections such as TB will cause a child not to be gaining weight because of the chronic weight loss that is there. The child may have a problem with the heart, a congenital heart disease, so this child won't gain the appropriate weight. So then the clinician examines and decides, based on what history and examination is taken, will decide the next appropriate referral to help this child start gaining weight. If it's an infection like HIV, we'll do the screening and decide, start the patient on treatment, and we'll see the improvement that is there. If it's TB, we'll screen for TB and start the treatment that is there. So in short, it's that the danger signs are there on the under 5 card, whether it's being done by a nurse, being done by another person, Once they see danger signs, they will refer appropriately to the next linkage, which is one of the aims of growth monitoring and promotion, referral to appropriate linkage systems. If it's a TB corner, the TB corner starts the TB treatment and we provide nutritional support, and this child will gain weight. So you notice that there's a thin line between malnutrition and TB. And interlink.
What should be the appropriate, course of action that a mother, a father should take if they notice that, their child is not growing according to the way they expected?
So the child is not growing up. The appropriate action is to come and seek health care, go to the nearest health facility, seek healthcare services from the expert. Not to rely on this hearsay from the neighbor will tell you this, the neighbor will tell you. You must remember that children are different. It doesn't mean because this one is not growing, it means that's why your child is not growing. Some children may be constitutionally small. You want a child whose parents are constitutionally small, and you want this child to grow as big as this other child. It won't happen. So that's why they must seek healthcare as close as possible to them. And when need appropriate be, if they're not comfortable, they can request for a referral to the next level of facility, so the interventions can be done and they can get answers that satisfy them.
So when you receive such special cases, what are some of the things that you take into consideration? A child is not growing properly.
Mm-hmm.
What are some of the, what do you look for?
How do you look for? So I always refer, we always study the simple basic things. The simple basic thing is getting a good history. So what do you mean by history basically in medicine is me sitting down, getting a story of how this child has grown. So we'll sit, you tell me how this child was born, whether this child cried at birth, how this child has been developing, what you feed this child on, any contact with TB, just a full history will get to help me, because once I know, okay, this child was a prem baby, so this child has been gaining this much weight, then I can say, okay, maybe there was this problem. This child has been gaining weight up to this point, then all of a sudden the weight started dropping. Then I start to ask what happened at this particular point that this child was dropping. Again, that's why you see that the under 5 cut comes in critically, because we'll be following up this child, plotting on the growth chart. Then all of a sudden this child was 10 kgs, comes today, the child is 7 kgs. Then I begin to ask what happened at this particular point. Was there a diarrhea illness that happened at that time? Then you begin to... So with a good history, combined together with a good examination, then you can come up with a diagnosis. Because you're not going to start treating blindly. It doesn't mean because this child is not gaining weight, then the problem is poor feeding. It may be another problem that is there. They may be having that this child is also not absorbing food that is taking. The food the parents are giving is adequate, and this child just can't tolerate that food. This child may just have a congenital heart disease. This child may just have TB. So there could be various reasons that can make a child not to gain weight. And therefore, during growth monitoring and promotion, referral to appropriate system or linkage to the appropriate healthcare provider is key, and one of the benefits of growth monitoring and promotion.
How often do you encourage mothers to be visiting healthcare centers, especially during the first 5 years of a child's life?
Okay, so that one is you see, it's a very good question. I like it because we notice the big drop in mothers attending to under 5 after the age of 6 months. So we encourage that mothers should bring their children to the under 5 for growth monitoring and promotion every month up to the age of 2 years. Between 2 and 36 months, they should bring their child at least every 2 months. Between 36 and 1 year, we encourage that they bring their child every 3 months. But even those parents that are able to bring their children every month, even up to the age of 5, they are very welcome, because that helps us intervene. So you will notice that mothers will come the first 4 months, have some immunization that the baby receives. Then the next, at 5 months when they come, there's no immunization given. At 6 months, no immunization given. Then the mothers begin to think, hey, why am I going to the hospital just for weighing? There's no need, let me stay home. But that weighing is very important. It helps us determine whether this child is growing well or not growing well. At 9 months, we have another immunization that we give, and at 1 year, 6 months. So you find that this dropout tends to affect our outcome in the immunization rate at 9 months and at 1 year, 6 months. And that also has a big bearing. Remember, with our HIV/AIDS pandemic, we need to be testing these children. So you find that at birth, we have a very good test rate. At 6 weeks, we have a very good test rate. At 6 months, our test rate begins to drop. At 1 year, we have a very low test rate. At 1 year, 6 months, even worse. Now we're even testing at 2 years. And this affects because our parents tend to drop out and stop bringing their children for under 5 or for growth monitoring and promotion. So we encourage all mothers to bring in the children for growth monitoring and promotion every month below 2 years, every 2 months between 2 and 3, and every 3 months between 3 and 5.
What usually do you advise if at all you realize that during your sessions with this mother, you realize that at some point she missed a certain session where a certain immunization was supposed to be done, and now a child might not be feeling too well, and you have that information with you. Do you supplement?
So I must say, first of all, we must encourage mothers whenever they come to the health facility. We must encourage them to keep coming. That helps them come every now and then. If you meet a health care worker who starts shouting at you for not coming, then we have a problem. Because you're asking the parents to stop coming, because they will start getting scared to say, if I go back, they'll shout at me. So healthcare providers are encouraged to be as warm as possible and welcoming all the time, such that when these mothers come and they've missed, let's sit down and find out why they have missed. Sometimes you may find that it's a very big reason that they missed the appointment, or they just didn't know that they need to come for the appointment. So it's a two-way thing. Either our communication to them was poor, that we didn't tell them they're supposed to come, or they just missed by themselves. But we must encourage them at all times. There is what you call catch-up immunization. For those who've missed the schedules that are adequate for them, we can give them the catch-up immunization to do that. So that we have a provision for catch-up immunization to be done and given to them. And we encourage them. Every time they come through, we encourage them, because the more people we cover, the better for the outcome. So there's even what you call herd immunity. So for instance, if I give, for example, like measles, if we did capture and gave our immunization schedule to almost 90% of our children, we reduce the risk of that one who has not gotten the immunization from getting the measles because of herd immunization. So we must encourage mothers to keep coming every now and then for the immunization schedules and for growth monitoring. We will not shout at them for coming. Even if they miss the appointment, they should just come and we should document and put it there. It's our duty to welcome them and be warm for them.
Some of the particular aspects that I noticed, which are part of the under 5 card, I think there is a reference of a proper diet for a child. Mm-hmm. Exactly, a proper diet for a child and all that. It could be a proper diet if you want your child to be healthy, and all that. Now, mothers usually have a problem when it comes to to administering a proper diet. You'd find that sometimes there is when a child is growing, obviously even the food intake usually varies. There could be fruits here. Now they want to introduce the child to porridge. They want to introduce the child to hard stuff and all that. What kind of consultation is needed between healthcare providers and mothers when it comes to a child's diet, especially when it reaches at that point whereby there's now a changing of food?
So I must say that feeding the young is quite a challenge. Several times I do get consultations from parents telling me, my child doesn't have appetite, let's give multivit. My child doesn't have appetite, let's give multivit. And most of the time I come back and tell them, we're not going to give multivit. Let us just give the appropriate feed. We start with this feed. So it starts like from the under 5 card. If you go to the inner part of the under 5 card, like that chart we projected earlier, it shows what feed we need to be giving, how many meals the child needs to receive the feeds per day. So we'll see that at around 6 months to 1 year, there are 3 meals per day and continued breastfeeding. So these are just the light meals, and this shows the curve. Even the weight gain at that particular time, there's just a slight, it will not be as rapid as the first 6 months, but it's a slow weight gain that you see. Then we'll notice that when the child is between 1 year and 2 years, this child needs to have 3 main meals, 2 snacks, and must continue breastfeeding. See? Then when we get to 2 to 3 years, the child has the 5 main meals. Even at 3 to 5 years, it's a 5 main meals. So that is shown on the upper part. We can see those meals that are there. Then right at the bottom, on the bottom right, you will see the feeds that the child needs to receive, and even the times the child needs to receive the feeds. So it has morning, lunch, and supper, when this child needs to receive the 3 main meals and the in-between snacks that are there. Then it gives us a different feeds that are there. So then you will see that in most of our shops, we do get this low-fat yogurt. And you find that the mother tells you, I gave my child yogurt as a snack at 10, I gave my child this. When you look at this low-fat yogurt, that's for you and me who don't want to gain weight. But our children need the full cream. So it's preferable that we can actually just blend, give them sour milk, blend with real fruits, and that way it works well. Than just have the babies getting low-fat yogurt, this and that. And then you find that there's a lot of these brands that are on the market that claim to have milk in them, claim to have this in there. All those are not appropriate for the child. So we must give appropriate feeds at the time. And then there's, for give an example, if you're going to feed a child Ishima, you get Ishima and you'll be dipping it in gravy. This baby is 1 year, has no teeth in the mouth to chew the meat. This child basically has only eaten Shima and gravy. So we encourage to blend. If you can blend the meat, you can blend even you can pound the carpenter, that's good protein. Irish potatoes, good protein source that is there, than just giving Shima and gravy. In the end, we're not giving anything, or we're giving a carbohydrate. That is even the mixture of the 1 teaspoon of groundnuts into a cup full of maize is not adequate, because you're just given a teaspoon, and then the mother will come and tell you, "Nimpasa porridge ansha," and yet the groundnuts in the porridge are not adequate. So we need to have a proper mixture, and all that is taught when the mother brings their child for growth monitoring and promotion. That is taught at the under 5 clinic.
What do you usually advise mothers in an event that, as the child is progressing, and of course as the child is growing and more food is being introduced on the menu, you discover that maybe the mother discovers that as the child is now getting into porridge and of course other hard stuffs, the child develops diarrhea and all that. Stop the food?
So when a child develops diarrhea, we're not going to stop breastfeeding. We'll continue breastfeeding. When a child develops diarrhea, the first thing we're going to do is, yes, we'll change the baby's nappy, clean our hands, or maybe with warm water and soap, if we can. Prepare ORS if we have. It's encouraged that at least we do keep a sachet of ORS in our homes, and just make sure that the expiry date is way beyond. If we had the expiry date 2020, we can keep a sachet at home, boil 1 liter of water, let it cool, add our ORS, and then we give the child ORS. And then we can take the baby to the hospital. There are also, when you get the hospital, we'll assess, or the clinic will assess for danger signs for diarrhea. If this child does not have any danger signs for diarrhea, we'll cancel the mother on the danger signs for the diarrhea. For instance, if the child stops breastfeeding, the child develops a fever, we see any blood in the diarrhea, and the child stops just refusing to take anything, then we say, okay, bring back the child. And then we also give something like zinc sulfate to help reduce the duration of the diarrhea. I must say that in children, we don't give anything to stop the diarrhea, especially diarrhea that is less than 7 days, it's just acute. It normally tends to resolve on its own. The treatment is just ORS and zinc sulfate, and when we continue feeding. And breastfeeding should not be stopped, it should be continued throughout. There's also the myth of saying breast milk goes sour when the mother doesn't feed. There's no way something that is in the body can go sour. It doesn't go sour. The mother should be encouraged to breastfeed. Even if the mother takes a trip away, they can come back and continue breastfeeding. It can't go sour.
Okay. Now, what do you recommend if a child has got no appetite? I'm sure those are some of the issues that you always encounter when you're having these conversations with mothers. You'd find that the mother will tell you, "Ina mwana wanga akana porridge unless nikampasa maheo, or unless nikampasa chaso, or unless nikampasa chaso." What do you recommend? What do you usually advise mothers in case their children do not have appetite?
Yeah, so that's a very difficult, that's a very common question. It's an everyday consultation that if you sit in the outpatient, that a parent will come to you saying, "My child is refusing to take feeds, my child is refusing this, give me multivit. I want to get this child." I must say, from the multivit that does increase appetite is not good for the child itself, because if you give that multivit, the most common side effect is that it keeps the child drowsy and they won't be active and playing. Children are supposed to be active and playing. So it's a matter of preparing the right foods. You find that giving sweet foods before meals tends to disturb the child's appetite. So you find that some mothers will introduce chocolate just before a meal, and then the next time the child wants to eat, there's no appetite. So it's a matter of now just giving a proper adequate feeds and the right feeds at a particular time to do that. It's not about saying give anything to stimulate appetite and everything. So a good history taking and examination is important. And most of the time, if the child is ill, there'll be a problem with appetite. Once the child is fine, they'll get a good appetite and eat. And then the others are now just about the counseling around the diet. What we give before this diet and what we do that. So for instance, a few days ago, I was seeing this mother who had just introduced chocolate to this child, and then they're telling me this child doesn't eat. So I said, no, if you're giving sweet foods before meals, the child's appetite will go. And then she says, oh yes, he likes eating a lot of chocolate nowadays. He won't eat because of that. So it's all about counseling on the diet that is important. This idea of giving multivit for appetite is not good.
Interesting. All right, so as we close it up for today, maybe just a quick recap in case we've had others who joined us just along the way. We were discussing growth monitoring and promotion. How can parents work together with the healthcare providers in ensuring that the maximum benefits and of course objectives of the GMP are attained?
Okay, so the whole thing about growth monitoring and promotion it works both ways. It's actually involves a multi-system. It involves the parents or the guardians itself. It involves the government itself in providing the facilities that are there. So the government has different levels where we're going to move from the lowest level at the community up to the highest level in terms of promoting the growth monitoring. So parents do play a critical role in growth monitoring and promotion. And growth monitoring and promotion is a preventive measure. You see, if parents are educated from the word go that growth monitoring is important, it helps reduce mortality. We're saying there's 75 out of 1,000 children that that are born die every year from preventable diseases like malaria, measles, malnutrition, pneumonia, and diarrhea. If we educated parents, we would reduce that mortality to as low as maybe 10 or even 0 if possible. So parents should be encouraged to bring their children. The government is doing its part. Well, they're providing the facilities. I think every district has a clinic that has growth monitoring and promotion going on. Growth monitoring policy was published, and it's there. The government is doing its part. So now the parents have to be encouraged. Those parents that are not bringing their children, whenever they come to the facility, as healthcare workers, we must encourage them and not shout at them for bringing their children. We must encourage them to bring their children next time, because growth monitoring is a process that links, not just about monitoring the child growing, but also links to other health facilities and services that are there. It is an important aspect.
Well, Dr. Zimba, thank you so much for being part of the program today, and of course for educating us, especially on the under 5 card. I'm sure that parents, fathers, mothers have benefited most. Thank you so much.
Well, thank you very much.
All right, so much of our discussion today was centered on growth monitoring and promotion, trying to see how we can actually ensure that our children are definitely growing. And of course, Dr. Zimba has done justice in passing out information pertaining how vital and of course important the under 5 card is, and of course how vital it is that mothers and fathers should be going for appointments during the first 5 years of their child's years. It's important that you keep the appointments and make sure that you don't abscond, you don't miss. And of course, to healthcare providers, make sure that you encourage as many mothers and fathers to come together as possible, so that together they work as a team in ensuring that the growth of their child is definitely there, and of course that their child is healthy as well. Thank you so much for your time. Make sure that you join us next week Sunday, same time between 13 and 14, as we come through to discuss another aspect of the health of children. As for now, it's bye-bye.